I'm Dr. Doug Liepert with Advent. So we frequently get calls from patients that say they were a patient at the sleep lab and they were diagnosed at the sleep lab. They've never really seen a sleep doctor, but they were given a machine and they just can't tolerate it. Dollars to donuts, the reason the patient's not tolerating that CPAP isn't because they were misdiagnosed, but because they didn't have a nasal examination and they don't have a good nasal airway. When you're looking at improving nasal breathing, balloon sinuplasty, treating that outflow tract, allowing the mucous membranes to become more healthy, can tremendously improve the airway. If I can help somebody breathe better without taking them to the operating room without general anesthesia, then that's obviously a better pathway for that patient every day of the week. So my career in medicine, and particularly ENT, came out of my own childhood illness. So I had a fairly uncommon bone abnormality called fibrous dysplasia that was affecting the ear, which is why this one looks funny compared to this one. And so I spent an awful lot of time in the hospital having operations about every 3 or 4 months and got to be very good friends with my ear, nose, and throat surgeon. And that's what really started my desire to become an ENT. And in those days, I had no idea that my path was going to go down one of sleep and breathing. So I think there's 2 parts of my job that I find really exciting. When people come and they stop you in the hall at the grocery store or the aisleway, I guess, and they say, "What you did really changed my life." The other part, and what I think is unique with the sleep and breathing model, is the ability to be all-encompassing when it comes to sleep quality. When the patient says, "I saw a lot of different people with complaints about my sleep, and you were the first guy that listened and put it all together."